Okay, hi, Dr. Wigoda. It
Hello.
is Breast Cancer Awareness Month for October, but
Correct.
every month we want to make women aware of the risks and the myths and the facts related to breast cancer. So the big question is, do breast implants cause breast cancer?
Okay, it's funny you should ask me that because I actually had a patient yesterday who had saline breast implants put in 10 years ago. And she showed up thinking she had to change them at 10 years. And when we talked about the different options, whether she wanted saline or silicone, she was afraid of having silicone implants because she thought they could cause cancer. The truth is, implants, whether saline or silicone, do not cause cancer, and that's been proven through many studies where they've looked at tens of thousands of women who've had implants for many years. The myth really started in the 1990s, where women were having problems with silicone implants. Implants were rupturing, they were having capsular contracture or hardening of the breasts. Some women were claiming they were having immunologic problems because of the implants. Most of those myths have been debunked. The implants really don't cause any medical problems themselves. There is some risk of what's called a capsular contracture, which is really just a scar around the implant. Although the implants that we have now are much improved over what they had in the 80s or 90s, so we're seeing that much less. But certainly, as far as breast cancer goes, breast implants do not cause breast cancer, and so that should not really be a concern. In patients who have a strong family history of breast cancer um, and are at high risk of breast cancer, one thing to know is that implants can make it slightly more difficult on mammograms to see a cancer. So that's something to consider, especially in patients who might be at very high risk of breast cancer. But the implants themselves won't cause the cancer to develop.